Ever wonder why your dental cleanings hurt so much? Ouch, stop poking me. Well, the reason that it hurts might not be because we're using those sharp instruments. You see, that pain that you feel when they're actually scraping and cleaning your teeth might actually be revealing something about the health of your gums. So in this video, I'm gonna break down a few reasons why your teeth are actually hurting at your dental cleanings and what you can do to fix it. So the first reason your teeth hurt is because of inflammation. So anytime you have inflammation in your mouth, it's gonna cause more pain. Now, inflammation in your gums is just another fancy word for gingivitis. You might have heard that before, or your hygienist might have told you that you have it, but actually a majority of people have some sort of gingivitis. Now, obviously some people might have more severe gingivitis compared to other people, but this is the #1 reason that you will feel pain anytime that you were getting a dental cleaning. You see, when your gums are inflamed, even gentle cleaning, like gentle scaling with the instruments or gentle flossing or brushing is going to feel painful. It's kind of like if you have a sunburn and you try to scratch it a little bit. Obviously that sunburn is gonna be a lot more painful versus just scratching your normal skin. The only difference is a sunburn you wanna leave alone, you don't wanna scratch it, versus your gums that are inflamed, you actually want to clean it. And that's because the reason that your gums are inflamed is because of bacteria or biofilm, these clusters of bacteria that build up and stick to your teeth and underneath your gums. And unless that is cleaned away, it's gonna keep causing more inflammation and it's gonna keep hurting and it's gonna keep getting worse. So the best way to fix this is after you're done getting your dental cleaning is to simply keep up with your oral hygiene at home. How many times can you say that you have actually brushed and flossed correctly every single day after your dental cleaning? Most people probably cannot say that. In fact, 70% of people do not floss their teeth. So I'm willing to bet that a majority of people cannot say that. But if you start tackling this right after your dental cleaning, it will make it so much easier. Because right after you get everything cleaned off, like everything's clean in your mouth, within a few minutes, you start getting biofilm or this bacteria that starts clinging to your teeth. You see, you can never really avoid these bacteria that start getting stuck onto your teeth. And within a few hours, this biofilm of bacteria will start to get sticky. This is what we call plaque. But this plaque or this sticky biofilm is what should be cleaned away anytime you brush and floss. This is why it's so important to do it every single day, because even within a few hours, you're gonna start getting this built up again. There's no way to really avoid it. But even if you skip like one time within like 12 to 24 hours, this sticky plaque can turn into tartar. Now, tartar is when this plaque gets stuck onto your teeth. And that's when this plaque mixes with all the minerals in your saliva and it gets kind of crystallized and it gets really hard. Now, this is pretty much impossible to remove at home. You're gonna have to go into your dental cleanings to get this scraped off. And this is why we recommend going to the dentist every 6 months to get your cleanings done. But if you were to keep up with this oral hygiene at home, like brushing and flossing every single day, not only are you gonna be strengthening your gums, but basically doing like a workout every single day by brushing and flossing underneath your gums, you're also gonna be removing a lot of this biofilm and plaque, so you're not gonna have as much tartar and as much of this inflammation. So it's gonna be a lot more comfortable getting your dental cleaning. Now, the second reason that your teeth might be sensitive is if you have any exposed roots. This is really common anytime someone has gum recession, where their gums basically pull back from their teeth and it makes their teeth look a little bit longer. Whenever that happens, it exposes the root of your tooth. Now, the root of your tooth is a lot weaker than your enamel, which is like the outer coating of your tooth. And your root is basically a channel to your nerve. So anything that touches any exposed root is gonna be a lot more sensitive. So any cold air or cold water or even like sweet things, or if they take that sharp instrument. And it's not even the sharp part of it, just like the cold metal touching your tooth can be sensitive. Some people get this when they grind and clench their teeth, and that can cause gum recession. Some people get it if they just brush their teeth super hard and super aggressively because they're basically scraping their gums away. And some people even get it from braces or orthodontics. If they ever try to expand your jaw or move those teeth more wide to make more room for your mouth, what might end up happening is those teeth might start getting pulled out of the bone a little bit. And when you have less bone, then you're gonna have less gums, and that can cause the gums to pull back. So there's a lot of reasons why you might have gum recession. In this case, you might want to use a sensitivity toothpaste, and there are some other like desensitizing things that you might want to talk about with your dentist, and they might be able to go over some other options too. Now, the third reason is if you have anxiety. I'm not trying to blame you for your pain, but if you are anxious, it actually triggers a real pain response in your body. This is really common for someone who, for example, needs a root canal. Anytime someone needs a root canal, their tooth is usually in a lot of pain, and the root canal is done to get them out of pain. but we have to really get that tooth numb before we can work on it. But if someone is really anxious and stressed out about the procedure before they get it done, a lot of times they will need extra numbing because they will feel that pain a lot more. And if you're a really anxious person, especially at the dentist, then this can be contributing to that pain at your cleanings. Now, I can't just tell you to stop being anxious because it's never going to be that easy. But we could offer something like nitrous oxide, which is like that laughing gas that you breathe in, and you'll breathe it throughout the procedure, and it's supposed to help calm you down. Now, nitrous doesn't really help with pain, but it helps with the anxiety, and the anxiety can indirectly help with the pain. So those are like the 3 biggest reasons why you might be really uncomfortable at your cleaning. So I hope this was able to help you. And the biggest thing to remember is the timing and frequency matters. If you skip a cleaning or you wait a long time to go in between, it's gonna be just like skipping doing your brushing and flossing at home. And it's gonna make those cleanings a lot more difficult, not just on the hygienist, but also on you. So make sure you stay consistent at home and stay consistent at the dentist, and then it's gonna be a lot easier. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. If you feel like you're constantly getting this plaque and tartar buildup on your teeth no matter what you do, then you're not alone. But what if I told you that some of the foods that you're eating could be contributing to this? In this video, I'm gonna go over some of the key foods that cause this plaque and gunk to build up on your teeth and what to avoid. Number 1 is sticky and carb